that's a holy grail that we haven't quite achieved yet, unfortunately. So in this meeting and in the last decade or so, the treatment for CLL has really improved at a fast pace. And so with combination therapies, we're really getting to the point where disease eradication is achievable, at least with current technology, to undetectable minimal residual disease state. But these therapies really haven't corrected the immune dysfunction in CLL. So it seems like treating the tumor alone, which is immunosuppressive, is not enough to restore the immune function in our patients. There are certain therapies that improve specific aspects of immunity. So one example are the BTK inhibitors. They seem to improve T cell function in patients with CLL, but on the flip side, because they are anti-B cell therapies, they also reduce further the B cell function. So CLL patients, for example, who are on BTK inhibitors are unable to form as antibodies to vaccinations. So it's still something that I think we're trying to work on in the CLL community. It's definitely an unmet need to try to improve the immune function of these patients. With patients living longer term disease-free, or I think that will just the immune dysfunction will just become a more important issue, because now that their survival is being extended, they're still having to deal with the morbidity and the mortality that comes with having an immunocompromised, being immunocompromised.